So good morning to everyone. So today we are going to discuss regarding the impression materials. So as you all know that so impression materials are very important for the any processes fabrication. So we'll start or we'll proceed with the impression making procedures. Then we'll end up with the results of processes. Okay. So impression materials plays a very important role for the fabrication of any kind of processes. Okay. So coming to the definition of impression material. So before going for the impression materials, you need to know what is impression. Okay. So a dental impression is a negative record of the tissues of the mouth. So dental impression is defined as the negative record of the tissues of the mouth and it is used to reproduce the form of the teeth and the surrounding tissues. A dental impression is defined as the negative record of the tissues of the mouth. It is used to reproduce the form of the teeth and the surrounding tissues by an compatible material. So this is definition of a impression. Understood? So impression is nothing but a whatever there in the patient mouth has to be recorded. So you will get a negative record of the tissues of the mouth using a impression material to make the positive replica so that it will be useful for your fabrication of the any processes. So next is what are the desirable properties which are necessary for the selection of the impression materials. So desirable properties of an impression material. See, when we choose an impression material, the impression material should be how, why, what are the importance of that impression material for that situation. That is very important. See, we are going for an primary impression material, secondary impression materials, and some conditions also require some special materials. So that is another method of selection. So minimum things has to be there to select for an impression material. So any material which are going to select should be fluid enough. Should be fluid enough so that it will flow properly in the mouth so that it can able to reproduce all the areas in the mouth. So it should be fluid enough. So it should be rigid enough. See, once the impression is over, you should be rigid so that you should not revert back. Understood? So whatever we are going to achieve by making an impression should not be revert back. So that is our main motto. So that's why we are going to record the impression. See, once it is retrieving from the mouth, it should not be distorted. That is the meaning. So it should have rigid enough. And it should have a proper working time. See, whatever we are going to mix and it should be loaded in the tray and we need to make an impression. So there will be a flexible time for an operator to work. Understood? That is your working time. So any material we are going to choose should have a proper working time. Okay, and so it should be known by the operator before using it. So that's why we'll choose a material which is having enough working time. See, these are very important points. So it should be fluid enough, it should be rigid enough, it should be proper working time. Understood? So along with that, it should have a pleasant taste, odor and aesthetic. And it should not be toxic or irritating to the patient. Understood? And it should be economical so that even operator can able to afford it and patient should not be overburdened. Understood? It should be economical. And it should have a adequate shelf life. See, once it is bought, should not be expired as early as possible. Okay? See, some dentists have more patients, some dentists have less patients. So it should have adequate shelf life so that it can be stored and it is used for a longer time. So that's why whenever we are selecting, you are supposed to check the adequate shelf life for a storage and for the distribution. Understood? And one more is, it should be used with the minimum equipments. So it should not be cumbersome. The procedure what we are going to make with the impression material should not be cumbersome. Understood? So it should have a minimum equipments so that you can able to make a proper records. And one more important thing is, already I told you, so it should be rigid enough and along with that it should be dimensionally stable. So that's what. So once it is removed from the mouth, before pouring of the cast, it should be dimensionally stable. It should not change any dimensions of the material. Understood? So while selecting, you need to know all these things. These are the main criteria. And one more thing is, so it should achieve a adequate strength. So it should able to achieve adequate strength after making an impression, so that once it is poured, it should be able to resist the weight of an impression material. See, once the impression material is poured, if it is not able to take up that load, then it is of no use. See, next is, we are going to get a positive replica by pouring the compatible gypsum products. Understood? So once the material is poured in the impression, it is not able to take up that weight, then it is of no use. That's why it should have adequate strength after making an impression. Understood? And it should have even elastic properties with the freedom from permanent deformation. So what is the meaning of it? See, some undercuts are there in the patient mouth. We have made an impression. So undercuts have been recorded in the impression. So while retrieving, it should have little bit elasticity so that it can be retrieved from the mouth. So that I will discuss in the later classes. Okay. So whatever we are going to select an impression material should have even little bit of flexibility or elasticity so that it will lessen the deformation, okay, while retrieving from the mouth or retrieving the cast from the impression. So while retrieving it, cast should not be broken. Understood? So these are some of the desired properties which are required for the whenever we are selecting for an impression material. So coming to the classification of impression materials. So according to Phillips Science of Dental Materials, all you read from the Phillips, no? The standard textbook. Phillips. Okay, Anusa Vyas or Phillips. So this definition, this classification is placed. So according to mode of setting, they are classified into irreversible and reversible. So irreversible meaning it cannot be reused or it cannot be used once again. Understood? Huh? So examples for irreversible impression materials are impression plaster, zinc oxide eugenol, even alginate can be, then elastomers. And reversible materials. So examples for reversible impression materials are impression compound, waxes, agar. Then one more thing we can classify according to rigid and elastic impression materials. So rigid impression materials and depending upon its flexibility. So depending upon the flexibility, impression materials are classified into rigid and elastic. So examples for rigid are impression plaster, zinc oxide eugenol, impression compound and waxes. Then elastic impression materials are alginate, agar, elastomeric impression materials. And one more classification depending upon the temperature change. So depending upon the temperature change, so once again impression materials are classified into chemically set, thermally set. So chemically set impression materials are impression plaster, zinc oxide eugenol impression paste, alginate, elastomeric impression materials. Then set by temperature change. Impression compound, waxes, then agar. So along with this classification, we have so many other classifications also. Okay. Depending upon the technique of impression making. Depending upon the technique of impression making. Mucostatic, mucocompressive and selective pressure. So mucostatic impression materials are impression plaster, waxes, Then coming to mucocompressive impression materials are alginate, even agar, so elastomeric impression materials having a more viscosity. So we have different viscosities in the elastomers. Okay, so elastomer will have 4 type of consistencies or viscosities. So which are having a high viscosity will have mucocompressive, low viscosity will have mucostatic. Then coming to selective pressure impression techniques. So selective pressure impression techniques, zinc oxide eugenol impression paste is a selective pressure impression material. So in this case, we are going to compress some tissues and we are not going to compress some tissues in case of selective pressure. So in case of stress bearing areas, will compress the tissue, which are non-stress bearing areas, we are not going to compress the tissues. So we told you while making a special tray. So special tray fabrication has to be done like that. So placing the spacer, okay, wax spacer has to be adapted where the areas which are not stressed. Understood? So in case of your special tray fabrication, we are not kept completely the spacer. Only selective places will be placed with the spacer. Understood? So that's why we are using that special tray to make a selective pressure impression procedure. Okay, so zinc oxide eugenol is used as a selective pressure impression technique. So even different consistencies of elastomers can be used, putty and light body. This is combination. So putty and light body is a combination we are going to make with the impressions. Okay. Stop. Huh? Okay, for this. Okay. So this is basics regarding the impression materials, general classification, then ideal requisites. So next class we are going to start with the impression materials proper. So we'll start with first rigid impression materials, elastomeric impression materials, elastic impression materials. Okay, so next class we'll follow with that. 80 minutes is well.
Sure. What is the cursor? Can you show me this? Cursor is with it's there.
So coming to the composition of the alginate. So it consists of sodium or potassium alginate, then calcium sulfate, zinc oxide, potassium titanium fluoride, diatomaceous earth, then sodium phosphate, then coloring and flavoring agents. So sodium or potassium alginate is the main ingredient. So it will react with the calcium ion of the calcium sulfate and it will proceed with the reaction. So it is a chemically set material, not like agar. So agar is a thermally set material. Understood? So we require a hydrocolloid conditioner and we require a temperature to reach gel to sol. Understood? So in case of alginate is a chemically set material. So it is having a ingredients of sodium potassium alginate, calcium sulfate. So zinc oxide acts as a filler, potassium titanium fluoride acts as a gypsum hardener, even diatomaceous earth will act as a filler. So sodium phosphate is a retarder. It will react with the calcium sulfate. It will increases the working time. So it is a retarder. It will react with the calcium sulfate so that it won't allow calcium ion to react with sodium or potassium alginate. So that we'll get a ideal working time for the alginate. Understood? So calcium sulfate reacts with sodium phosphate. First, the reaction number 1 is, so calcium sulfate reacts with sodium phosphate, then it will allow calcium ions to react with sodium or potassium alginate, so that the reaction will be delayed, so we will get a proper working time. Understood? Then along with this we have a coloring and flavoring agents for the comfort of the patient. So you understood the composition? So main thing is calcium sulfate is an reactor, sodium phosphate is an retarder. So first reaction will be with the calcium sulfate and sodium phosphate. By this we will get a calcium ion. So calcium ion reacts with the sodium or potassium alginate, forms the gel. Understood? So this is also a hydrocolloid. So it converts to salt to gel. So setting reaction, already I told you, sodium phosphate reacts with the calcium sulfate. So it forms a calcium phosphate plus sodium sulfate. So this will delay the reaction. Directly reacts with the calcium ion with the sodium alginate. So by this we will get a sodium alginate as a gel. So coming to the properties of alginate. So alginate has pleasant taste and smell. So that's why manufacturers added some flavors to the alginate, so to make comfortable for the patient. And it is flexible enough because it is an elastic impression material, so it has flexibility. So by the advantage of flexibility, we can use this material for the any undercuts. So after engaging the undercut, it will flex and it will release and come to the normal position. So this is the advantage of alginate impression material. So it has a good elasticity and elastic recovery also. Same like our agar. So elastic recovery will be 98.2%, not like 99.8% in case of elastomers. So it has fine reproduction of details. So it can able to reproduce the fine reproduction of details. So compressive strength is around 70 megapascals. Then TS strength is around 350 to 700 grams per centimeter square. So it is a dimensionally stable material. Have you manipulated the material or handled properly? So it is an hydrocolloid. The properties like syneresis, imbibition will be present in this material. So it will be related to dimensional stability, so that whenever we are making an impressions, it has to pour as early as possible to avoid this syneresis and imbibition. So this is also hydrocolloid. There may be chances of syneresis and imbibition in this also. So to avoid that, you need to pour as early as possible. So it is also having some difficulty in adhering to the tray. So there won't be any mechanical interlocking directly. So that's why we require a tray which has having a holes. Perforated trays are required for alginate. So that will provide you mechanical interlocking. Understood? So whenever we are manipulating the alginate, so there should be perforated trays to get a proper adhesion to the tray. So coming to the manipulation. So ornamentarium required for the manipulation is, so we require a flexible bowl, curved spatula, say not like straight spatula. Straight spatula will be used for the gypsum products. So in case of alginate, we require a curved spatula. Understood? So curved spatula is required and a plastic bowl. So we will take a proper amount of water. So it is an hydrocolloid. We require a water as a medium to mix it. So calculated amount of water has to be taken. Then calculated amount of powder has to be dispensed. So before dispensing of the powder, the can should be aerated or fluffed. It's like that, so that all the ingredients should be uniformly distributed, and keep it stagnant for 1 minute. Then open a lid of the can. Understood? So then you need to take a powder from the can and it should be dispensed in the bowl. So you need to take first water, measured amount of water has to be taken, then measured quantity of the powder has to be dispensed. So manipulation. So how to mix? So mixing time is around 1 minute. So working time is around 2 minutes. So setting time is around 3 to 4 minutes. It depends upon the type 1 and type 2. So I told you type 1 is fast setting, type 2 is normal setting. So it depends upon the material which is used. So once water and powder has been taken in the bowl, so the spatulation should be started. So spatulation is, so we should start from the, so it should be stirred motion. Stirring motion has to be started so that all the particles will be distributed in the water and it should be moistened. Okay, once the, so it is around 15 to 20 seconds we have to stir it. So once the stirring is over, then we start wrapping around the walls of the bowl. So it is also around 15 to 20 seconds. So first 15-20 seconds stirring. Next 15 to 20 seconds wrapping around the walls. Understood? Next around 10 seconds you have to make it figure of 8. The spatula should be spatulated in the like 8 motion. So like this. So after last 10 seconds it has to be, once again we have to wrap around the walls and collect the material and we'll load the tray. Understood? So around 60 seconds you have to mix it. So mixing time is around 1 minute. So first is stirring motion, then wrap around the walls. Understood? Then figure of 8 for 10 seconds. Then once again we'll wrap around the walls and collect the material and load the tray. This is the way we'll go for a manipulation. So you understood regarding the manipulation? So we'll demonstrate in your practical classes. Okay, next classes onwards we'll demonstrate. So coming to the advantages of alginate. So this is a material for a learner. So it is easy to mix and manipulate. So even learner can be use this material. Understood? So even it has a low cost, not expensive material. It is comfortable for the patient also. And it is an hygienic material. So even good surface details can be recorded in case of excessive saliva also. See, if it is properly handled, it is an accurate material. And it doesn't require much instruments. Understood? So it's not like our agar. Agar requires so many cumbersome instruments and it has to be maintained properly. So it is not like agar, so it requires very less instruments. So coming to the disadvantages. See, as already told you, it is a primary impression material, so that it cannot be electroplated. It is an irreversible impression material, so it cannot be corrected. Once impression made is over. So if anything you need to correct, you need to make one more impression. So it cannot be corrected. So if you are not handled properly, the dimensional stability is not good. So you're supposed to take care of the syneresis and imbibition. Then only dimensional stability. So it has a poor tear strength as compared to elastomers. As compared to elastomeric impression material, So it has a poor strength, tear strength. So distortion will be there if you have not handled the syneresis and imbibition. So you kept in a moist environment or dry environment, it may change because it is an hydrocolloid. So this completes your alginate. So any doubts? Understood? Have you gone through before? Have you read?